Hi everyone, welcome back to the USMLE series. As usual, we're going to start with a question. So the first question there, a 79-year-old woman dies from heart failure. Cardiac tissue shows perinuclear yellow-brown granular inclusion. So that sounds like what we call lipofuscin. What is the mechanism of formation? So the best answer there will be free radical induced lipid peroxidation. And the second question there, which free radical is primarily responsible for DNA damage following ionizing radiation? So the best answer there will be the most destructive free radical, which is hydroxyl free radical. So today we're going to be talking about free radical mediated cell injury. And if you guys remember from the previous lecture, we started talking about different agents that could lead to cellular injury and maybe ultimately lead to cell death. And one of those things that we spoke about in the past was hypoxia, right? We spoke about hypoxic cellular injury. And if you've not watched the video on hypoxia cellular injury, I would definitely encourage you to check out that video. So today we're going to focus on free radical mediated cell injury. So what are these free radicals? So free radicals are highly reactive molecules with an unpaired electron in their outer orbit. And because they have this unpaired electron in their outer orbit, so they can steal electron from other molecules. So they steal electron from other molecules, thereby making them unstable. And because of this, this could lead to a lot of chain of reactions. And ultimately, this chain of reactions could lead to cell death. And when you look at some of these free radicals, it's not all of them that are bad. So some of them are actually there in our system for a very good cause. So for instance, microbial killing, so killing of bacteria, especially in the neutrophil, in the monocytes. So they use reactive oxygen species, as we're going to see later in the course of the lecture. But we also have, God also put a system in our body to be able to defend us against these free radicals. And when these free radicals overwhelm those defensive system, this could lead to what we call oxidative stress. So oxidative stress is the damage caused when there are too many free radicals for the body antioxidant defense to handle. And when you look at these free radicals, their primary target is usually the DNA, so the nucleic acid, the cell membrane, right? Those are the areas where they are targeting. So they can cause DNA breaks, right? Membrane lipid peroxidation and a protein oxidation, which we're going to see later in the course of the lecture. So let's now look at some examples of free radicals. What are the examples of these free radicals? So there are some, we call them reactive oxygen species, ROS. So why do we call them reactive oxygen species? Because they are derived from oxygen. So that's why we call them reactive oxygen species. So example includes superoxide, hydrogen peroxide, hydroxyl free radicals, nitric oxide, and hypochlorous acid, right? And then we also have some that are not derived from oxygen species, right? So example include carbon tetrachloride and acetaminophen free radicals. So moving on. So the next thing we're going to talk about is that what's the mechanism of free radical injury? So in other words, how do they injure the cell, right? So like we mentioned earlier, this free radical, they targeting the nucleus, right? The DNA, and then they also targeting the membrane, the cell membrane, the organelle membrane. So let's see how they're able to cause those damages. So one, they target the lipid in the cell, right? And then we know that lipids are present in the cell membrane, in the organelle membrane, right? As phospholipid. So this free radical, they will react with this phospholipid and the polyunsaturated fatty acid of the cell membrane. And that process is what we call lipid peroxidation. Make sure you remember that we're going to talk about it later. Lipid peroxidation. And this lipid peroxidation will produce peroxyl fatty acid radicals. And that will lead to membrane permeability, right? So depending on where the membrane permeability, is it the cell membrane, is it the organelle membrane, then that will determine the manifestation we're going to see. So with this lipid peroxidation of the cell membrane, so that will make the cell membrane to be permeable. So when you look at the cell membrane, now they become what? Permeable. And then guess what? As a result of that, that could lead to increase in cytosolic calcium. So there could be a lot of calcium influx into those cells, right? And like we said, you don't want too much of calcium inside the cell because they could activate anything. Just like what we discussed when we did hypoxia, whereby under irreversible hypoxia, right, whereby there is inhibition of the calcium ATPase cannot take calcium out of the cells anymore, and thereby leading to what? Thereby leading to cell death, right? So same thing, similar thing here. So this calcium, they're going to activate phospholipase, so that could further break down the phospholipid in the cell membrane, thereby leading to more cellular permeability. Endonucleases breaking down the nucleus, and the proteases breaking down the cytoskeleton, breaking down the protein in the cells. And of course, this will lead to cellular injury, and ultimately it's going to lead to what? Cell death, right? And I'm going to talk about necrosis later, which is another form of cellular death, right? Same thing, mitochondria. So it can cause mitochondrial membrane permeability. And as we mentioned in the past, when you look at the mitochondria, there's an important chemical in that mitochondria. You don't want that chemical to leave the mitochondria, except if there is a need for cell death, right? And that chemical is what we call cytochrome C. So with this mitochondrial permeability, that cytochrome C now is going to leave and come into the cytosol. And guess what? It's going to activate caspase. And that will lead to what? Apoptosis, which is also another form of cell death. And that's going to be a discussion for another day. So what are the other targets of these free radicals? So they could also affect the protein. So they cause oxidation of those protein. And that leads to cross-linking of those amino acid and a fragmentation of them. So this could lead to things like enzyme inactivation, and it could lead to damage to the cytoskeleton. And what was the last target of free radicals, guys? DNA, right? So the nucleic acid. So these free radicals, they could cause DNA fragmentation, right? So they could break those DNA. And then once they cause DNA damage, right, God puts a particular check in our system, right, which is a form of tumor, what we call tumor suppressive or suppressor gene, right? And this one is P53. So if there's a damage to the DNA, this P53 is going to arrest that cell that contains that DNA damage, is going to arrest it in the cell cycle. And anybody know which phase of the cell cycle? Very good, right? The G1 phase. So it's going to arrest it at the G1 phase, right? Preventing it from going to the cell cycle to divide. And the reason why it's doing that is to allow for repair, so that we can repair those DNA damage. And guess what? If we can't repair those DNA damage, or if the damages are too much, then this P53 is going to activate what? Apoptosis, and that will lead to what? Cell death. And like I said, we're going to talk about apoptosis at a later lecture. And if P53 is unable to destroy those cells, and if the cell mistakenly go into the cell cycle and start to divide, that means we have cells with a lot of DNA damage in them, right? So that could lead to mutation, and that could lead to what? Carcinogenesis, which means which can lead to cancer, right? So that's how free radical causes their injury. So now let's move on to the next point now. So what are the sources of these free radicals? So where are they coming from, right? So these free radicals, some of them are produced from normal metabolism. So like a regular metabolism in our body. And one of them is the electron transport chain, right? So in the electron transport chain, we use remember the electron transport chain is located where? In the mitochondria. So during the oxidative phosphorylation or in the electron transport chain, those electrons, we pass them from complex 1, right, all the way to complex 4. And the reason for that, so that we can use those electrons to convert to reduce the oxygen to what? To water, right? And during that process, that's how we're able to generate what? ATP. And of course, when we get to biochemistry, we're going to talk about this process in details. So, but the problem with this is that about small percent, about 1 to 2% of those oxygen are incompletely reduced. And because of that, they could now lead to what we call what? Superoxide free radicals. So those incompletely reduced oxygen, they leak from the electron transport chain and they leak into the system. And that is going to be what? Superoxide free radicals, right? The next way under normal metabolism is in the peroxisome. So in the peroxisome, during the breakdown of fatty acid, which is what we call beta oxidation of fatty acid, that will also produce what? Hydroxy free radical, right? Which is a normal byproduct from it. And the last one under normal metabolism is the cytochrome P450, right? As we know, the cytochrome P450 is located in the liver, right? Particularly which organelle? The smooth endoplasmic reticulum. And this is important for drug metabolism. And during those drug metabolism, free radicals could be produced and they could be released into the system. So that's one source. So normal metabolism could be a source for free radicals. And that's why we have system in our body to be able to defend against these free radicals. So another source of free radicals is inflammation. So inflammation could lead to release of free radicals. And under inflammation, the first one we're going to talk about there is what? Respiratory burst or oxidative burst. And like I mentioned earlier, remember I mentioned something important earlier, that free radical is not that bad. It's also very important in our system, particularly in killing microbia, right? In killing bacteria. And that's where this respiratory burst come into picture. So this respiratory burst, they are present in things like neutrophil, monocytes, and they are activated whenever there is things like infection or tissue necrosis or cytokine. And the first step in this reaction is going to be oxygen, right? So oxygen. So this oxygen will be taken up by these cells, the neutrophil, the monocyte, right? And that's why oxygen is also good for the body. So it's not only important in making ATP, we also need oxygen to be able to fight against infection, right? So that's why whenever somebody has infection, they're having fever, guess what that fever could do? It could right shift the oxygen dissociation curve, thereby favoring the release of oxygen into the tissue. And the neutrophil, the monocyte are happy. They will take up the oxygen to be able to generate what? Bleach to kill the bacteria. So let's say how we're going to produce the bleach. So now, so they take the oxygen, and that oxygen will be converted to what? To superoxide, right? And the name of the enzyme that is going to help us to convert to superoxide is going to be what? NADPH oxidase, right? Our NADPH oxidase. So that NADPH oxidase is going to convert the oxygen to superoxide. And this superoxide now, right, we're going to further break it down to what? Hydrogen peroxide, right? So we're going to produce hydrogen peroxide. And then by the help of what? Superoxide dismutase. So superoxide dismutase is going to convert to hydrogen peroxide. And also with sometimes with spontaneous reaction, the superoxide could be converted to what? Hydrogen peroxide. And this hydrogen peroxide now, we're going to now add chloride to it, right? So we're going to add chloride to it. And then once you add chloride to it, guess what you're going to form? You're going to form what? Bleach. And then guess what this bleach is going to do? This bleach is going to bleach and kill the what? And kill the bacteria. And the enzyme that is involved in the conversion of, in this reaction, whereby we're adding chloride to hydrogen peroxide to form bleach is what? Is myeloperoxidase. So that to be myeloperoxidase. So let's look at the notes. So when neutrophil and monocyte are activated by infection or tissue necrosis or cytokines, they undergo respiratory burst, which is a rapid increase in oxygen consumption dedicated to reactive oxygen species generation. So the NADPH, like we mentioned, is going to convert the oxygen to superoxide, which is going to be the first step in that cascade, right? And the hydrogen peroxide, so the superoxide now will be converted to hydrogen peroxide by the help of what? Superoxide dismutase or spontaneous reaction, right? And we're going to talk about Fenton reaction later when we talk about meta. And the hydrogen peroxide, so from hydrogen peroxide, you can also produce what? Hydroxyl free radical from hydrogen peroxide. And we also have the, so now we're going to now add chloride to the hydrogen peroxide, right, by the help of myeloperoxidase to be able to form what? Hypochlorous acid, which is the bleach. And that bleach is going to kill the bacteria. And of course, it will also damage what? Tissue. And this is important to remember here, guys. The myeloperoxidase, right, that is contained in the neutrophil is responsible for the green, it's a green enzyme that give pus its color. So they could ask, right? So somebody was having, maybe they're having pneumonia and they're coughing out a lot of junks, right? And they said the sputum looks like green. And they will ask what's responsible for the green color of the sputum or the pus. So the answer is going to be what? Myeloperoxidase. Very important. And there could also be problem in this pathway, right? So if a patient has, so a patient could have deficiency of what? They could have deficiency of NADPH. So they could have deficiency of NADPH oxidase. And that condition is what we call chronic granulomatous disease. And in this patient, they will not be able to generate superoxide, and they can't form hydrogen peroxide, and they will not be able to form bleach to be able to kill the what? Bacteria. But in these patients, right, anytime we have infection in our body, so anytime we have any form of infection, those bacteria that are also coming in, causing those infections, they also bring in their own hydrogen peroxide. So they also bring what? Hydrogen peroxide, right? And what our body could do is that our body, right? So if a patient has NADPH oxidase and they can't produce hydrogen peroxide, then the neutrophil and the monocyte can still take the hydrogen peroxide that is coming from those infections and add chloride to it to form bleach and use it to kill that bacteria, right? But guess what? There are some bacteria that are very, very smart. So we have some smart bacteria. And what those smart bacteria, what are they doing? They have catalysts, right? And they use the catalyst to convert this hydrogen peroxide to what? To water, right? And oxygen. So because of that, they cannot use the hydrogen peroxide from those bacteria to be able to form bleach. So that's why patients who have NADPH oxidase deficiency, they are more prone to what? Catalyst positive organism. And can someone give us example of catalyst positive organism? Very good, staph, right? So staph aureus is a good example. Another example is also what? Aspergillus, right? So that's why those patients who have chronic granulomatous disease, they're going to be prone to those infections. What about if somebody have myeloperoxidase deficiency? It doesn't matter, right? Even if the bacteria comes with tons of hydrogen peroxide, they still cannot form what? Bleach. So those patients are going to be prone to both what? Catalyst positive and a catalyst negative what? Infection. So moving on. So still under inflammation. So under inflammation, nitric oxide will also be produced, right? So during inflammation, right? During inflammation, either maybe as a result of infection, right? There's release of what we call acute phase cytokines, right? An example of those acute phase cytokines include interleukin-1 and TNF alpha. And guess what these acute phase cytokines they're going to do, right? So they can induce production of nitric oxide. So they will stimulate the nitric oxide synthase either in the endothelial cells, in the neurons, or in the macrophage, and that will lead to production. So we're going to convert. Anybody know what the name of the amino acid that we use to make nitric oxide? Very good, L-arginine. So we're going to convert those L-arginine, right, to, we're going to convert them to what? To nitric oxide. And then those nitric oxide, they could directly damage cells, right? And you can also, they could react with super oxide to form another very destructive free radical, which is peroxyl nitride, which is ONOO minus. And this is highly toxic, guy. So moving on. So we finish inflammation, right? So moving on to another source of free radical. So another source of free radical is radiation. So radiation is another source of free radical. So what's this radiation doing? So this ionizing radiation, they will take the water, right? So they take the water, right? And then those water, they convert those water to what? Hydroxy-free radicals. So this ionizing radiation, they has enough energy to ionize water molecules inside the cell. And this hydroxy-free radical is the most dangerous. It is the most dangerous free radical of all. So out of all the free radicals we've spoken about, the most dangerous is the hydroxy-free radical, right? And this is the idea how we use radiation to treat cancer. So remember, a patient will have cancer, maybe certain tumors, we give them radiation. And what's this radiation going to do? This radiation is going to take the water inside those cells and then generate hydroxy-free radical from those cancer cells, right? And then those hydroxy-free radicals, they're going to break the DNA. And once they break the DNA, like we mentioned earlier, then that will trigger p53 to activate what? Apoptosis. And that will lead to death of those cancer cells. And this is not only targeting just only the cancer cells. It also affects normal cells, especially those cells that are always in the cell cycle actively dividing, right? Those actively dividing cells, which is what we call them labile cells, right? So those cells, example, include things like bone marrow, G epithelia, germ cells, hair follicles. So it could affect those. And that's why people who are on radiation or on chemotherapy, right? So they could have cytopenia, right? Whereby the cell lineage are decreased. They could have diarrhea, mucositis. They could have infertility. They could have alopecia, whereby they are losing their what? Hair. Moving on to the next source of free radicals, which is from drugs, right? So, or chemicals. So chemical like carbon tetrachloride, right? So this carbon tetrachloride is converted by your cytochrome P450, right? And it's going to convert them to trichloromethyl radical, right? And guess what this radical is going to do? This radical can induce lipid peroxidation, right? So it's going to damage those cell membrane, right? Or membrane, the membrane of those organelles. It could also damage the endoplasmic reticulum of the ribosome. It could decrease apoprotein synthesis, and ultimately they lead to what? They lead to what we call fatty liver. A lot of fat in the liver. And the end product of this, so you're going to see swollen fatty hepatocytes, cell membrane rupture, and that could lead to centrilobular necrosis in the zone 3. And because remember, zone 3 is where those cytochrome P450 are located. And that's why zone 3 is more prone to what? Metabolites. So when they're exposed to metabolites toxin, right? That is going to damage what? Zone 3. Remember, we also spoke about zone 3 when we did hypoxia. We said that zone 3 is also more prone to what? Hypoxic injury in the liver, because zone 3 is far from the what? Blood supply. Another medication that could also produce free radical is acetaminophen, which is what we know as paracetamol or Tylenol, right? So the cytochrome P450, right, system, so particularly the CYP2E1, which you have to remember this name, guys. You have to remember it. So this is what normally metabolites. Each time you have overdose or too much of acetaminophen in the body, this system is going to metabolize those acetaminophen into NAPQ high, which is a toxic reactive metabolite, right? And this is normally detoxified by glutathione. So that's why in patients who overdose on acetaminophen, their glutathione is going to be depleted, right? Because they're using those glutathione to be neutralizing these toxic reactive metabolites. And this toxic reactive metabolite is going to accumulate, and that will lead to free radical damage. And their major target is usually what? Liver. So it can lead to liver hepatic necrosis. That's why one of the most common causes of acute liver failure is what? Acetaminophen overdose. And it's important to mention at this point that sometimes patients who are taking normal dose of acetaminophen, just by taking normal dose, not overdose, and they're also drinking a lot of alcohol. So those alcohol could induce this, they could increase the activity of this CYP2E1. And because of that, that will start converting the acetaminophen to free radicals. So even though they are taking normal doses, that will convert it to free radicals. And what's the treatment for acetaminophen overdose? The treatment is what? N-acetylcysteine, which is what we call NAC. And how do they work? They replenish glutathione. Remember, they replace back this glutathione for those what? For those patients. Moving on to another source of free radicals, so which include cigarette smoke, right? Remember, cigarette smoke contain polyaromatic hydrocarbon, nitric oxide, and peroxynitrate. And all this could lead to what? Endothelial injury, and that could initiate what? Arteriosclerosis. They could also initiate increased activity of elastase, which can damage elastin in the lung, and that could lead to emphysema, which is what we see in COPD, right? And can somebody tell us which enzyme inhibits the activity of elastase? Very good. Alpha 1 antitrypsin, right? Remember, alpha 1 antitrypsin is going to inhibit activity of what? Elastase. So that's why somebody who have alpha 1 antitrypsin deficiency, the 1 million advice you want to give to them is not to what? Not to smoke. Very good. Moving on to alcohol metabolism. So the ethanol metabolism in the hepatocyte will also generate free radicals. So it could generate things like acetaldehyde and a reactive oxygen species. And of course, this will also damage the what? Liver. Moving on to the next source of free radical, which is metal. So heavy metals will also produce what? Free radicals. And in the process where they generate this free radical is what we call Fenton reaction. So Fenton reaction. So those heavy metal, right, they combine with hydrogen peroxide, and after combining with the hydrogen peroxide, then they generate what? Hydroxy free radicals. You can see that. So they generate hydroxy free radical. And like we said earlier, these hydroxy free radicals are the most dangerous free radical of all, right? And this explains why patients who have certain condition whereby they have too much of heavy metal in their body, like condition like hemochromatosis, right? They produce a lot of what? Hydroxy free radicals, and that will lead to damage in their system. So that will lead to lipid peroxidation, DNA damage, and fibrosis. And what are the in patients who have hemochromatosis, right? So it could affect their liver, so they could have liver cirrhosis, it could affect their pancreas, they could have diabetes, it could deposit in the skin, they could have Crohn's. So that's why we call it Crohn's diabetes. So anytime you see a question whereby they're talking somebody who have diabetes, they have hyperpigmentation of their skin, liver cirrhosis, you should start thinking about what? Hemochromatosis. It could also affect their pituitary, thereby having hypogonadism, and it could also deposit in the heart, thereby leading to what? Cardiomyopathy. And classically, this could lead to either restricted cardiomyopathy or dilated cardiomyopathy. Another condition is also Wilson disease, which we're going to talk about when we get to GI, guys. We have a long way to go. So with Wilson disease, this is a copper problem, right? So these patients are having problem excreting the copper through their bile, right? And too much of copper, same thing through Fenton reaction, will generate hydroxy free radical. And that could affect their liver, leading to liver cirrhosis, and it could also affect the basal ganglion, leading to things like dysarthria, dystonia, Parkinson, tremor, and so on and so forth. And they could also have psychiatric what? Symptoms. Other conditions that are also where free radicals are implicated. So one of them is ischemia, right? Or what we call reperfusion injury. So reperfusion injury, right? And this reperfusion injury could happen in the setting of maybe acute myocardial infarction or limb ischemia. So if somebody is having acute myocardial infarction because of blockage of the coronary vessel, guess what's going to happen because of this blockage, right? There's going to be increased release of what we call local metabolites. So there ought to be increased release of what? Local metabolites. Can somebody give me an example of this local metabolite that will be released? Very good, right? Nitric oxide, CO2, right? And even decreased oxygen, the hypoxia itself. These are all part of the local metabolites. And this could also happen in the leg too, right? So if somebody have critical limb ischemia and the blood vessel is blocked, right? Same thing. Those local metabolites will also be released, right? So the local metabolites in the skeletal muscle will be things like carbon dioxide, hydrogen, adenosine, lactate, and potassium, and many more. And guess what these local metabolites are trying to do, guys? They're trying to cause vasodilation, right? Trying to see if there's a way they can help with this what? Obstruction. So when these patients show up in the hospital, right? Either because of acute myocardial infarction or because of limb ischemia, when they come to us, our goal is to establish what? Perfusion. So we're going to open up this blockage, right? Either maybe by medication or by intervention. So once we open up those blockage, what's going to happen now? Now blood is going to start flowing to those areas along with what? Oxygen. But guess what? Because of this local metabolites, that will lead to a lot of blood flow to those what? To those tissue. And guess what is going to happen? Xanthine oxidase. Make sure you remember that enzyme. The xanthine oxidase is going to convert those oxygen to what? Superoxide free radicals. And that will lead to reperfusion what? Injury. So, like a question, somebody who came in for chest pain, right? Was diagnosed with acute myocardial infarction, but the chest pain has been going on for, let's say, 12 hours, right? And let's say the troponin was around 10,000, just an example, right? And then the patient was emergently taken to the cardiac lab, and we opened up the blood vessel, and after reperfusion, we saw that the troponin went to 20,000. The only thing that could explain why a troponin can go from 10,000 to 20,000 after reperfusion will be what? Reperfusion injury. And it's mediated by superoxide free radical by the help of what? Xanthine oxidase. Another example is retinopathy of prematurity. So when we have a baby, right, or particularly premature baby or baby who are born to diabetic mom, right? Remember with diabetes, the baby have increased, baby that are born to diabetic mom, they have increase in insulin, and those insulin could inhibit their surfactants, and that could predispose them to neonatal respiratory distress syndrome. So this baby, if you give them too much of oxygen, right, especially if it's more than 50% FiO2, those oxygen could be converted towards superoxide free radical, and that could damage their retina. So that could lead to retinopathy of prematurity, and that could lead to blindness. The next one is cellular aging, right? So cellular aging is the next one. So with cellular aging, the free radical damage is a major contribution to aging. So free radical damage is actually part of what? Part of aging, which leads to loss of proliferation and function. So over time, these reactive oxygen species, they damage the membrane lipid. Remember, we spoke about it earlier, lipid peroxidation, right? So now the lipid, right? So those lipid or phospholipid, right? Inside the cell membrane, we're going to add hydrogen peroxide to them. And that process is what we call lipid peroxidation, right? So, and that will lead to formation of oxidized lipid fragments. And guess who is going to feed on them? Lysosome. So lysosome is going to engulf those oxidized lipid. But the problem is that lysosome will not be able to digest them because they are indigestible pigments. So they will start to build up in different cells, in different tissue, and we call them what? Lipofuscin, right? And we also call aging pigments. So when you look inside different tissues, for example, if you look inside the heart, you can see those deposition there. So they appear as yellow brown, and we also call them wear and tear intracellular pigments, which are found in tissue. And here's the board question. This is a normal age-related findings. So if you have a question, somebody who died, they did autopsy, and they saw this brown deposition in the heart, those are what? Lipofuscin, and they are produced as a result of what? Lipid peroxidation, and they are normal age-related finding. And the next one there is atherosclerosis. So the bad cholesterol, right? Which one is the bad cholesterol? The low density lipoprotein. So this low density lipoprotein, they could enter the intima, right? Remember with atherosclerosis, damage to the endothelial cell, right? And then this LDL have the opportunity to enter the what? The intima. And once they enter the intima of the blood vessel, guess what's going to happen, right? Then the reactive oxygen species is going to oxidize them. So now we're going to form what? Oxidized LDL. And this oxidized LDL, guess what? They are cytotoxic. They are toxic to the cell. They can stimulate inflammation. They are highly inflammatory, right? So now macrophage is going to now engulf this oxidized LDL, and that's going to form what? Foam cells. And then with time, they're going to form what? Fatty streaks. And then that fatty streak is the earliest atherosclerotic lesion that we see in the blood vessel. And then with time, what's going to happen? They could form what? Atheroma, and that could lead to blockage of those what? Blood vessel. And when we get to cardiovascular system, we're going to have fun talking about what? The pathogenesis of atherosclerosis. So now we've covered sources of free radicals, right? So now we're going to now talk about the system that we have in our body that defend against these free radicals. So cellular antioxidant defense system, right? That help with neutralization of free radicals. So we divided them into two. We have some that are enzymatic, and we also have the non-enzymatic. And we've seen a couple of this already, right? So we saw superoxide dismutase, which will convert superoxide free radical to hydrogen peroxide. We saw catalyst already, right? So catalyst in the peroxisome, that will convert hydrogen peroxide into water and oxygen. The next one is glutathione peroxidase. So this glutathione peroxidase is located in the pentose phosphate pathway. And this glutathione peroxidase is important for neutralizing hydrogen peroxide, hydroxyl radical, and NAPQ1. Anybody remember this NAPQ1? Yes, from acetaminophen, right? So it's toxic intermediate from acetaminophen. So this glutathione peroxidase is important for neutralizing these guys. So, and that's why patients who have glucose phosphate dehydrogenase deficiency, right? Remember, the glucose phosphate, right, is important. The glucose phosphate is important. The glucose phosphate dehydrogenase is important for conversion of glucose phosphate into 6-phosphogluconolactone. And this conversion will also help to reduce this oxidized NADP plus to a reduced NADPH, right? And this glutathione peroxidase now is going to indirectly use this reduced NADPH to be able to neutralize free radicals. So that's why if a patient has glucose phosphate dehydrogenase deficiency, that means they will not be able to produce this reduced NADPH. And if there's no reduced NADPH, that means that will lead to decrease in activity of glutathione peroxidase. And guess what's going to happen? If this is in the red blood cells, right? So if this is happening in the red blood cell, those free radical, particularly those reactive oxygen species, those free radical, they're going to make the hemoglobin to clump together. So those hemoglobin, they are going to what? Clump together. And once they clump together, what do we call that clumping? We call it what? Hence, that's what we call hence body, guys. Hence bodies. And then guess what? When macrophage is taking a trip and he saw those hence body in the red blood cell, guess what he's going to do? He's going to take a bite. He's going to try to bite it out. And that's going to now create what? What we call bite cells, right? So both bite cells, right, and hence body, both of them are seen in what? In G6PD deficiency, and that will lead to hemolytic anemia. And then moving on to the non-enzymatic antioxidants. So under non-enzymatic antioxidants, so we have vitamins there. So vitamin C and E, both of them are antioxidants. So they can actually help to donate electron, right? So they help to neutralize those free radicals by donating one of their own electron, thereby stopping those what? Electron stealing. And they themselves, they are still stable. Even though they're able to donate an electron, they are still what? Stable. And the vitamin E, right, on the other hand, which is a form of fat-soluble vitamin, is very good to prevent lipid peroxidation. Make sure you remember that. They love that, right? So help to prevent lipid peroxidation, and it will also help to neutralize what? Oxidized LDL. Whereby vitamin C, on the other hand, which is a water-soluble vitamin, that helps to neutralize free radicals that are produced by pollutants or cigarette smoke, right? So that's why people are smoking cigarettes. They could be deficiency in vitamin C because they are using their vitamin C to be neutralizing what? Free radicals. And it will also help to neutralize hydroxy-free radicals. Well, we spoke about glutathione already. Another one is selenium. So selenium is also incorporated into the active site of glutathione peroxidase. And this is important, guys. Remember this. So selenium is incorporated into the active part of glutathione peroxidase, thereby allowing it to be able to what? Do its job. So that means if somebody is deficient in selenium, that will affect the activity of glutathione peroxidase, right? Remember, we spoke about glutathione peroxidase earlier. And the last one are serum proteins. So we also have some serum proteins that also help to combat free radicals. So we have transferrin, which bind to iron, right? And they're making it soluble. We also have ceruloplasmin, which is also an antioxidant. I know it has been a long lecture, guys. We have finally come to the end of this lecture. So let's do some questions, guys, before we close this video. So first question, 45-year-old man undergoes percutaneous coronary intervention after an acute myocardial infarction. Shortly after reperfusion, right? It looks like they want to ask us about reperfusion injury. His troponin levels rise further and it develops arrhythmia. What is the primary mechanism of this worsening injury? So the answer here will be what? Reperfusion injury. And this is going to be what? Free radical mediated cell injury. Remember we mentioned, we said that the xanthine, right? Oxidase, that xanthine oxidase will convert the oxygen to what? Superoxide free radicals. Next one, a patient with hereditary hemochromatosis accumulates excess iron. Which reactive oxygen species is most directly generated by iron to damage the hepatocyte? And this is the most destructive free radical, which is what? Hydroxy free radical. Question 3. Which of the following is a selenium-dependent antioxidant enzyme that protects cell from free radical injury? Remember, we said that selenium is important to bind to the active site of what? Glutathione peroxidase. It allows it to do its job. Next question. 75-year-old man dies of chronic heart failure. Histology of the myocardial tissue shows perinuclear brown pigment granules, right? Which is what we call the lipofuscin, guys. What is the most likely mechanism of this pigment formation? Remember, we said that this is due to what? Lipid peroxidation. And this is a normal aging finding. And the last question, we're almost there. Which vitamin primarily protects membrane from lipid peroxidation? That's what? Vitamin E. We've come to the end of today's lecture, guys. Don't forget to like, subscribe, and follow us on our social media platform. And I will see you guys in the next lecture. Bye for now.